Baltimore, with a population of over 600,000, is the largest city in Maryland. Home to not only the Ravens and the Orioles, but to the national anthem, the oldest public medical school, and the first public library. Among the many things Baltimore is proud to call its own are the state's two premier medical centers, the University of Maryland Medical Center and the Johns Hopkins Hospital Center, each of which house top-ranked medical and nursing schools. Patients are referred and transported daily to these two centers from sites throughout the state, the region, the country, and the globe. Cutting-edge research from these centers changes the way medicine is practiced throughout the world. Why is it then that our babies, particularly our Black babies, are dying at rates higher than in developing, war-ravaged, or totalitarian countries such as Panama, Bosnia, and Cuba? So, while the usual answer to the question, why are our babies dying, is a list of the most common medical causes of fetal and infant deaths, this official cause of death is just the tragic conclusion of a story that starts long before. To answer this question requires looking beyond the halls of medicine. The path that leads to the death of a baby starts well before a baby is born, before a mother gets pregnant, back to when the mother herself was a baby, and even earlier.
Across the nation as a whole, infant mortality is an issue. There are factors of access to care. There are going to be factors such as education, in terms of when people get engaged in care. There's going to be provider education. Not all providers in all counties are aware of all the things that may cause, for example, preterm birth and small for gestational late infants. There's going to be resources, and resources mean in post-birth, what available resources are there? Do we have the same level of resource when someone is pregnant as when they're not pregnant? Do we make it as easy to gain access to? And then once that child is born, for example, how do we support a parent?
We cannot leave this entirely in the hands of the neonatal intensive care units, nurses, midwives, and doctors, because by the time a woman has her first prenatal visit, most of the story has already been written.
We are now recognizing that it is more important to enter pregnancy healthy than ever before. We need to take the opportunity to reinforce some behaviors that women should participate in prior to conception. Obviously, the number one is stop smoking. Number two is decrease alcohol consumption. The number one reason for mental retardation that we can actually do something about, losing weight. So we are having an opportunity to get women involved early, prior to conception, for their health. It's the health of the woman entering the pregnancy that makes the biggest impact.
While prenatal care ideally starts prior to a woman actually becoming pregnant, once a woman is pregnant, it is important for her to receive early and comprehensive prenatal care by providers competent in the screening for and management of risk factors for poor birth outcomes. However, the barriers some families face to accessing services are so great that these services may as well be located 60 miles away.
In Baltimore City, many of the women in many of the communities do not have cars. Sometimes grocery stores are not close. You cannot find a grocery store within maybe 15 blocks, and you'd have to walk. You don't have resources to get there. Not having insurance is a real barrier. So it's just really difficult sometimes for parents. It's not that the pregnant person does not want to have a healthy baby, but it's just that they cannot see or meet the needs of what needs to be done to have that healthy baby.
Many women do not qualify for comprehensive health coverage when they are not pregnant, and therefore do not receive adequate care prior to becoming pregnant again. A majority of pregnancies in the U.S. are not planned, and therefore many women enter pregnancy without having had the opportunity to prepare for the pregnancy.
What women need to do to enter pregnancy as healthy as they can is multifaceted. We need better family unity, we need people in the city with better jobs, we need better health in our young children, we need exercise programs, after-school care programs. Our young teens are not being taught, or if they are being taught, They're not listening to their elders in regards to safe sex, healthy lifestyles. We're seeing lots of sexually transmitted diseases. There was a trend that was showing a decrease in teenage pregnancies. Well, that trend has now been reversed in Baltimore City, and we're now seeing again the rise in teenage pregnancy rates. So from a social standpoint, we have a lot of work to do.
We do not always know when a woman, a family, a neighborhood is going to be welcoming a baby, which is why we must ensure the continuous health of our neighborhoods, families, and men and women of reproductive age.
You know, in other systems, we have grandparents, great-grandparents, aunts, uncles. We have larger social structures. In our structure of working moms, for example, we don't have that. We have families that are small, sometimes fragmented. So we don't have that continuous support that I think you'll need starting from the beginning, preconceptional, to the end. What's happening in that first year of life to give that infant a good start?
This is a complex problem, but we cannot turn away from it because of that. There are multiple achievable goals that in the aggregate can decrease infant mortality. We must recognize that we have a lifetime to make a difference from the moment a baby is born through when they become a parent and then after. This is not an issue that can only be dealt with in our halls of medicine. It takes all of us.
The reason why we have poor birth outcomes, I do believe, for many women is because they just don't have the resources to access the services that they need.
We must look for new solutions that are evidence-based, even if it means that we work with unconventional partners. We must incorporate businesses and donors. We must be creative. We can't wait. We must address this problem now. Our babies are too precious to do anything else. We can do this. The question is, what will you do?